Hi, everybody. This is Tracy Malone from narcissistAbuseSupport.com. Today, I have got a really special guest to introduce you to. Dave Wyner is a therapist here in Colorado and recently came to my support group and gave us this talk on PTSD. Now, at the end of our conversation here, he's going to give you this documentation, the thing that he handed out at my group. And so stay tuned and listen for that. And you can send him an email and request that to be sent over to you right away. But today we're going to talk about PTSD and the origins of trauma, the big T, the little t. Do you know what those things are? I found it fascinating when he came and talked to our group and educated all of the people there. But we're also going to talk about how our body responds to this trauma and why it leaves such a big impact on us. And what's the real difference between trauma and PTSD, and how do we treat trauma? And how long does it take to heal? Everyone always asks me, when will I get better? When is this going to change? So without any further ado, let's welcome Dave, because we've got a really long show here, and it's worth listening to. If you never read a book on PTSD, if you don't go out and get some counseling, this is going to be an hour-long video without question. He did it in 2 hours in my group, so we've cut it down quite a bit, but the information that you're going to hear here is unlike anything else that you're going to find on another YouTuber, recovery channel, because it's really digging into the nuts and the bolts of what PTSD is. And let's get us started on healing. So let's welcome Dave. Thank you so much for joining me, Dave. Hi, Dave. Thank you so much for joining me.
Thank you. It's a pleasure to be here.
I am so excited because you came to my support group, was it like 2 months ago or so?
Somewhere around there, yeah.
And you talked to us and you gave us a PTSD lecture and talk to the group. And I just loved what you said. I thought it was so professional, and I thought it explained it to the survivors in my group in a way that, they could really wrap their heads around, like from the bottom of what is PTSD and going from there. So today we're going to talk and talk about PTSD and hear from you everything that you taught my group.
All right. Happy to be here.
Good. So thank you. I want to talk about basically what constitutes a traumatic situation in which someone might get PTSD. I know there's like big T, little t, and besides that I'm a T. What does big T mean? Right.
Well, talking about what constitutes a traumatic experience is a really good place to start, because we can't just jump into what is PTSD before we understand what is trauma. Mm-hmm. So I have a pretty broad definition of trauma. My definition is any experience that a person perceives as a threat to his or her emotional or physical safety or even survival, and that they feel powerless or helpless to handle, or that exhausts or overwhelms their resources to handle it. Mm-hmm. So, if you and I saw a burning building, we'd run away because we don't have the resources to handle it. If a firefighter sees a burning building, that's not necessarily as traumatic because they have the resources, the training to handle that situation. As far as the big T and little t, the way to think about big T trauma is what we all kind of normally think about as trauma, what Hollywood tells us is trauma. A car accident, a physical assault, combat, the big kind of catastrophic event. Little t trauma, which is just as powerful, I would argue sometimes even more powerful, are the more subtle and sometimes pervasive experiences. Childhood abuse, childhood neglect, invalidation, the loss of a relationship, the loss of a beloved pet. These are things that may not be the stuff of Hollywood movies, but they can leave a serious impact on our psyches, on our bodies, on our brains. Really, though, at the end of the day, it doesn't matter how I define trauma, doesn't matter how you define it, or your mother-in-law or your boss. All that matters is how you define trauma for yourself.
Okay. So while we're talking about that, my question to you is, so many people that I know that have had CPTSD, PTSD, doctors don't really know how to diagnose this. Is this really something that a therapist or professional of that level versus the family practice doctor can identify?
That's a good question. I guess I'm a little disappointed that a family practice or internal medicine doctor wouldn't recognize some of the signs. I guess the challenge might be, if you're a hammer, everything is a nail. Mm-hmm. So if you're a medical doctor, certainly not all medical doctors, but some might look at physical symptoms and not see a physical reason. Right. And then the patient is left thinking, well, maybe it's all in my head. Yeah. And the reality is, it is actually all in your head and your body, because both have been changed. Your brain and your body have been changed by the traumatic experience. And that's really the root of PTSD. We just don't have a quick blood test or a quick X-ray to see it.
Right, exactly. So how does our body react to the trauma? Because this is something that, for me, I know that I couldn't sleep. I couldn't eat. I lost 4 sizes in my clothing during that episode. I would stare out at the window. I would walk into rooms going, what was I doing here? Oh, forget it. Come back here. Remember what it was. Go back and forget it again.
Sure.
What other symptoms? How would this manifest in their body?
So before we kind of talk about how it manifests after a traumatic event, I think it's important to talk about how our body is brilliantly adapted to survive a traumatic event.
Okay, perfect.
So I can really geek out on the neurobiology of it, even though I'm the first to admit I'm not a trained medical professional or a neurobiological researcher. But it's very interesting. The body has something called the autonomic nervous system. And that nervous system has 2 branches. And the one that we're concerned with in this conversation, at least to begin with, is called the sympathetic nervous system. That's nature's evolutionary gift to us after millions of years. That's what keeps us safe in a threat. And that's the system of the brain and the body that responds to threat in a way that you've probably heard of: fight or flight.
And having that guy follow you.
Right. That's what it's designed to protect us against. In modern life, most of us don't have tigers chasing us, but the brain has still evolved with the exact same mechanisms. It's not even a conscious choice. The part of the brain that detects threat starts sending signals that we can talk about to the body within 1/25th of a second. So it doesn't even reach our conscious understanding or choices. In fact, when you're experiencing a trauma, our brilliant, human brain up here at the front literally is cut off from the rest of our brain. The signals stop working back and forth, because if you're being chased by a lion, this part doesn't really matter as much as the more survival-based, more ancient parts of your brain. So we kind of can call that lizard and wizard brain. The lizard brain is that, millions of years old evolutionary gift, like I called it, that is only concerned with, how can I keep this body alive? Mm-hmm. The wizard brain is what we've evolved into, that can, build a space shuttle and choose, where we want to go eat, things like that. none of which is important if we're being chased by a lion or if our brains think we're being chased by a lion. So, and that's an important point. The brain cannot necessarily distinguish between, am I being chased by a lion, or do I just think I'm being chased by a lion? And we'll probably talk more about that as we talk about some of the symptoms of PTSD. The third aspect of the sympathetic nervous system is less talked about, but no less powerful. It's the freeze instinct. So our first instinct is always going to be, I should say our body's first instinct is going to be, can I fight this or can I flee from it? Well, a lot of times, neither one of those is a viable option for whatever reason, whether that's because the lion has its jaws around our neck or because we're in a relationship and we feel stuck and we can't be physically aggressive toward our partner, and we don't feel like we can run away or escape. And in that case, the sympathetic nervous system kicks into the freeze response, which is the body's way of protecting ourselves, minimizing pain, and basically getting ready for the trauma that we can't escape. And you know, the perfect example of this is if you're watching Animal Planet and you see a gazelle being hunted by a lion. If the lion catches the gazelle's going to go limp and just freeze. And what that's doing, this is going to be kind of gross, but it's protecting that gazelle from the pain of being eaten alive. So our brains have a very similar mechanism. For us, though, it can look like dissociation. It can look like zoning out. You know, a lot of people, when they're in a traumatic situation, let's just call it a car accident. It's virtually impossible to remember the details right after the event. That's related to our freeze instinct and what our brains and bodies do to protect us from that pain.
So is that, like, as an example, a lot of people who have had childhood trauma don't remember. I don't remember many of my childhood years.
Right.
I know that's very similar. Like, the memories are just sort of socked away because you became this, I have to protect and survive mode.
Very much. And that leads really well into the discussion of why does trauma leave such an impact? And why can't you remember your childhood? And the short answer, again, I can really geek out on the neurobiology, is to the limits of my knowledge. But the short answer is because trauma changes your brain and it changes your body. It changes how your brain is wired. One of the systems that is affected is your memory system. And just neurologically, it makes it very difficult to form those memories, those autobiographical memories. And if you think about it, in the midst of a trauma, memory is not really that important. So that's not an example of the brain malfunctioning. It's an example of the brain doing what it's supposed to do in the trauma. So one thing I really stress to people is that if you have continuing symptoms of being in that trauma response and that fight, flight, or freeze response, that does not mean you're broken. That just means your brain is over-adapted. It means it's stuck. But it doesn't mean that you are irreparably harmed or that you have no chance of healing from this wound. So trauma affects other networks or systems in your brain. One of them is the threat perception system. After you experience a trauma, it's not uncommon for that system to kind of go into overdrive. That's why one of the classic symptoms of PTSD is hypervigilance. Our brains lose some ability to tell what's a real threat and what's not. It's almost like a circuit that's been overloaded. At least that's how I sort of envision it. So there's a real difference between I am safe and I feel safe. And that's a difference that the traumatized brain can't really make real well. So that's why trauma survivors often feel really threatened when someone looking from a distance might say, well, you know, what are you reacting to? There's no threat here. Again, at the end of the day, it doesn't matter what anyone else says, it's what you're feeling. So another system that's affected is the filtering system that helps our untraumatized brain determine what's important. Pick out in our scene or in our life or in our schedule or in an interaction with a person, what's important, what's relevant to me. So that makes it difficult for a trauma survivor to stay focused on a conversation or to weed out the irrelevant information or stimuli or interactions with a challenging person. So those two systems malfunctioning, you can kind of begin to see how that manifests in some troubling challenges and symptoms. Another system that's overloaded or that's rewired is the self-sensing system. That's the system that helps me tune into my body and my emotions. And in a trauma, that can go offline, and unfortunately it can stay offline or at least degraded. Because if you think about it, feeling emotions in the middle of a trauma could get in the way of surviving that trauma. At the very least, they're irrelevant. At the worst, they're dangerous to feel those emotions. And the brain knows this. So that self-sensing system can go offline, or like I said, it can be degraded. Challenge, though, is that that doesn't just discriminate against the negative or scary emotions. It also dampens your ability to sense happy emotions, which explains why a lot of trauma survivors have sort of a flat kind of presentation. They don't get real upset, but they also don't feel happiness or joy. They're just sort of right here because both ends of that have been sort of dampened because this system has gone a little haywire.
Does that come back?
It can, certainly, and that's part of the treatment of PTSD.
Okay.
A man named Bessel van der Kolk is one of the world's leading traumatologists, and he wrote an amazing book called The Body Keeps the Score. One of his ways of thinking about this is thinking about the changes in the brain, is to say that you have a smoke detector, a watchtower, and a cook in your brain. The smoke detector is that part of your brain that detects a threat. And we've talked about how that sort of just gets overloaded or gets stuck in the on position. The watchtower is that part of your brain that determines how do you react to that. Do you call every, if there's a forest fire, do you call every firefighter in the 3 states, or do you just get a fire extinguisher? How do you react to what your smoke detector has
warned you about?
Detected? And then the third, the cook, is the part of your brain that stirs all of this together and creates or synthesizes a story of your experience. And that's a really critical kind of part to remember and to think about as we discuss PTSD and how to begin healing from it. And it also gets into how the body is changed. The body, I like to think of it as trauma is stored as chocolate chips as opposed to chocolate syrup. And that's the cook in your brain that hasn't been able to kind of synthesize or stir together melt those chocolate chips. And the chocolate chips represent the sensory snippets that trauma survivors can remember. It's the smell of the hospital. It's the sound of screeching tires. It's the blow of domestic violence, on their ear. Those sensory snippets, the body's really good at remembering. But what it's not good at doing, again, because in the midst of the trauma, it didn't need to, is melting all that into a cohesive story. So that's one way that the body has been changed by trauma. You remember, your body's muscles remember, and your body's senses remember those experiences, not cognitively, but viscerally.
Mm-hmm.
The challenge that creates, one of them, is that it makes it very difficult to connect with or to feel safe in your body.
Mm-hmm.
And that's a complaint a lot of trauma survivors have. If they're even aware that they don't feel safe, hard to connect with the body, hard to connect and feel safe with your own emotions.
Mm-hmm.
And the ultimate unfortunate response is that all makes it very hard to connect to others. A lot of trauma survivors tend to isolate, which is too bad. Understandable, but too bad, because one of the main ways we can heal is in connection with other people.
Mm-hmm.
But for a trauma survivor, that feels unsafe at the beginning.
Yeah.
Yeah.
Absolutely.
I just sort of babbled a whole lot.
Oh no, I love it. That's why I wanted you here. Your geeky stuff. This is explaining it to people in more than I had PTSD and I walked into a room and forgot what I was doing. This is
Right.
actually helping them understand what perhaps their doctor didn't teach them.
Well, good. Yeah. I'm sort of skipping ahead, I think, in our conversation, but the first step that I believe one needs to take when, undergoing treatment for, trying to heal from, move beyond a traumatic experience, is sort of to do that reframe. It's instead of I am broken or I have a disorder, it's I have experienced an injury, I have a wound. There's reasons why my brain and my body are doing what they're doing, even though the trauma might have happened 2 years ago. Mm-hmm. I'm not broken. That's I think the very basic shift that is required before someone can even begin the healing journey, because it's that misunderstanding that I think disempowers so many survivors.
Yeah, absolutely. I think you said something about the PTSD when we were in our meeting, that I don't know what it was. You'll get to it, I'm sure. But it was basically identifying that it was not situational, but you're not broken, in other words, that you can be fixed. And holding on to the story of I have PTSD, I'm going to ride this out for the rest of my life, doesn't allow you to heal. But
yeah,
breaking that tie to a permanent state allows you to find a solution and start to heal.
You're absolutely right. And I think what you're remembering is my sort of redefinition of PTSD. I was actually just in a pretty emotional debate with a trauma survivor about this. This person really wanted to identify with the disorder. And that's fine. Strictly speaking, people are disordered because their brains and their bodies are not functioning, I'm going to use big air quotes, normally, whatever that word means. So strictly speaking, yeah, I guess you could call it a disorder. I prefer to think of it as post-traumatic stress injury or a post-traumatic stress wound.
That was what you said.
Well, and I'm not the only one who thinks that. I took it one step further. I believe language is really important in everyday life, and especially when we're on some kind of healing journey. How we talk about something affects how we think about it, and how we think about it affects what do we do about it. So the acronym PTSD is so ingrained. It's no longer a fringe kind of knowledge. It feels like it's really part of popular culture.
Mm-hmm.
So keeping those same letters, instead of post-traumatic stress disorder, I consider it pre-thriving situational distress. It might sound like wordplay. And okay, it is wordplay, but I think it's really important wordplay because first of all, going from post-traumatic to pre-thriving immediately shifts my perspective. It's not that something has happened to me and my life is always measured against that experience. It's pre-thriving, which is a very future-oriented perspective. And I believe very strongly that people can not only survive horrific traumas, they can continue growing and continue being a purposeful.
They can thrive.
They can thrive. Yeah. A lot of survivors aren't ready to hear that. Maybe that's not even accurate. They're not ready to believe it. And that's very understandable. The hope is that through their journey, they can see that, yes, they are post-traumatic, but they are also pre-thriving. So the S or the SD, situational distress, might sound like I'm minimizing, like, an assault is not a situational distress. And I'll be the first to admit that some situations are catastrophic, some are life-changing, some are lifelong. I still believe that calling it situational distress indicates that what I'm feeling is not because I'm broken. It's because of a situation I have experienced or I am currently experiencing. But it's the situation that has caused the symptoms, not a weakness in me or not a brokenness. The end result of this, kind of reimagining is to empower, or at least hopefully to empower the survivor. Not to forget, certainly not to forget, I'm not that naive, but to place into context what he or she has survived and learn to keep moving forward, not in spite of that trauma, but in conjunction with, to carry that, but carry it in a way that allows them to look forward and not only to look backward.
Right. I like that a lot. I think that is such important advice for people, regardless of the PTSD diagnosis, everything that they're experiencing with narcissistic cluster B trauma is situational. You don't have to live there forever.
Right. That's an important point. That's kind of, if the people watching this only remember one thing, what you just said is that thing. You don't have to live here forever. Is it easy to move past? Heck no. I would never in a million years call this easy. Is it possible? Heck yeah. And that's what the journey of healing looks like. Before we get to the journey of healing, though, you asked a little while ago, what is PTSD? What does that look like?
Yeah.
So for mental health professionals, sort of the diagnostic Bible is called the DSM, the Diagnostic and Statistical Manual. And that's the reference against which clients are diagnosed. What do they have?
Like the recipe book. If they have these symptoms, then it's chicken piccata.
Exactly. As an aside, I'm not a huge fan of diagnosing people. I don't particularly believe in labeling people. People are way more than a diagnosis. People are people who happen to be experiencing these symptoms. But this is the yardstick we have to measure these symptoms against. So there are 4 sort of categories of symptoms that professionals would look to when diagnosing PTSD. The prerequisite, however, is officially to experience an actual or threatened death, serious injury, or serious violence. I don't personally think that's a wide enough net to cast, because that immediately eliminates other kinds of traumatic experiences from an official diagnosis. I'm not sure how specific or how tightly mental health professionals, adhere to that prerequisite. Some maybe, some might cast a wider net than I do. But the 4 categories of symptoms are re-experiencing the trauma, meaning nightmares and flashbacks. Avoidance symptoms, meaning going to great lengths to avoid thinking about the experience, talking about it, going to places that remind you of it, getting involved in situations that remind you of it. Right, okay. Maybe it's, me and my spouse used to be on a softball team together. And since this traumatic experience, I can't even look at a softball. I can't watch baseball on TV, let alone go play on a softball team.
Right.
That's avoidance.
Mm-hmm.
Understandable, because your body is, I'll use the word stuck in that trauma response. And if I were to go to a softball game, then my brain, remember, doesn't really know the difference between I am safe and I feel safe. So in that softball moment, I'm going to feel like this could happen all over again. I'm remembering, my body is remembering and getting ready for that trauma. So of course I want to avoid it. It makes perfect sense. Another example of, you're not broken. You're doing exactly what your body needs to do at this point in your journey. The third category is changes in mood and thought. That could look like aggressive behavior. It could look like loss of interest. It could look like feelings of guilt or shame. These ways that our emotions and our thoughts are changed in relation to the trauma and in relation to our life in general. And then the fourth category is changes in reactivity. We've talked a lot about that. Changes in sleep patterns even. Being easily startled. Or the other side of that is being shut down and zoning out. That would be considered a change in reactivity, something that used to be really exciting to you, or that you used to get really, lit up by, doesn't mean anything anymore. It's almost like, that part of you is empty. And that might be called dissociation.
Yeah. Well, I when we were getting ready for this interview, I was in my room and fluffing my hair, and my son was at work, and all of a sudden, like, there he was, and my startle reflex, I just like shut up, like screamed, ah, this is years later, and I still have the startle thing. It just hasn't been able to cease yet.
Well, and I, at the risk of sounding pessimistic, but let's be realistic, it probably will never go away completely. And I don't know if you'd want it to. The startle instinct is life-saving. It exists for a reason. I guess maybe the hope, I would reframe the hope into, can I relearn what is important enough, what is threatening enough to be startled by?
Yeah, like my kid, probably not, but.
Well, again, easier said than done. And if you're looking in a mirror, fluffing your hair, and all of a sudden you see a shadow behind you, to some degree, that's a really well-adapted response.
Right.
You're gonna startle because it's a startling situation. It's just, do you need to startle at a 10 when maybe a 3 would have done the trick? If the doorbell rings, is that a life-threatening situation? If the oven timer goes off,
right,
is that a life-threatening situation? You're the one who set the timer, but still, if a car backfires, that's sort of the classic for a returning combat veteran.
Right.
that can trigger an incredible fight or flight response because his or her brain and body are still in that fight or flight response.
Right. Makes sense.
So just, very concretely, what is PTSD? What can PTSD look like? Because I think you asked that a bit ago. Head and back pains, stomach aches, heart palpitations, unexplainable sudden sweating, changes in your sleep pattern. Either you can't sleep or you sleep too much, nightmares, flashbacks. And a flashback, it's worth mentioning, is very different than remembering something. It's reliving something. Someone who has not survived a trauma or who has survived and has progressed through his or her healing journey can remember a situation and keep sort of a context, a distance from it. Someone who's in the midst of a PTSD or an unresolved trauma, if they try to remember it, it's not at arm's length. It's, oh my God, it's happening now.
Mm-hmm.
My throat is swelling up, my mouth is dry, my ears are ringing, my body is shaking. That's because you're reliving it. Your body actually thinks and your brain actually thinks, I need to get ready to protect myself. My life is in danger. Emotional swings, outbursts of rage, difficulty trusting, self-blame and shame. These are all really common experiences for someone who's struggling with unresolved trauma.
Mm-hmm. Yeah. And I know that lots of people will experience some kind of trauma in their life.
The vast majority of us will. The statistics, I think, are that 70% of adults have experienced some kind of trauma. Now, does that mean combat or being chased by a lion? No. But that gets back to sort of the wider net that I cast regarding trauma. Now, the interesting thing that research also shows is that a very small percentage of those people actually develop clinically diagnosed PTSD. That doesn't mean they don't have unresolved trauma, and that doesn't mean they're not dealing with some very real, scary, annoying, troubling symptoms. It just means that officially, only 10% of the people who experience trauma are actually diagnosed with PTSD.
Okay. Are more women? Is there a male-female kind of thing in there?
There is, and I suppose we could debate for a long time that particular point. Is it something hormonal or biological that predisposes women to PTSD, or is it how women are traditionally socialized in our society? Again, I'm sure we could have that debate for a long time, but the fact is, yes, more women than men are diagnosed with PTSD.
Are there risk factors that
Yeah. One of the biggest risk factors is about your upbringing, your childhood attachment. Attachment is a really, really big and important topic that we probably don't have time to really get into here. But one of the attachment styles that that children grow up and into is called disorganized attachment. And that's when your caregiver, in a nutshell, that's when your caregiver is either unavailable or even worse, is causing the trauma. That can create a disorganized attachment style that affects all of our adult relationships and even the relationship we have with ourselves. And that unhealthy or disorganized attachment is a real risk factor for, if you experience a trauma, you're more likely to experience symptoms of PTSD. Not receiving enough support after the trauma, after the traumatic experience. Again, remember I said that a lot of trauma survivors have a tendency to sort of pull back. And that's a defense mechanism, and it works really, really well until it becomes part of the problem. And that problem is if you either don't have or you reject support, whether that's professional support, support groups, or ideally support from close family and friends. If you don't have that support, that increases your risk for carrying this unresolved trauma. Certainly a past diagnosis of an anxiety problem or depression can predispose you to developing this unresolved trauma, PTSD response. And really so can your personality, again, I wish I was a neurobiologist, but how you're wired can predispose people. You know, we've all known people who just seem to be Teflon. Yeah. Things just don't stick. We could debate for a long time how that comes about. I believe that a lot of that is luck of the draw, luck of how you're wired. Certainly genetics play a factor. You know, if you have a parent who has anxiety or depressive issues, that also can predispose you. A lot of risk factors. The good news is there are also resilience factors, or factors that can help you avoid or minimize your unresolved trauma symptoms. One of the big ones, kind of the flip side of what I was just talking about, is seeking out and finding adequate support. Being able to talk to someone who you know is safe, who you trust, being able to just be in connection with someone is a huge buffer for feeling that unresolved trauma. Having positive coping strategies. After we survive a trauma, it can be very natural to want to escape. We don't want all of these memories, and it's not even a cognitive memory. It's that body. We don't want to feel like this. We don't want the neck aches or the stomach aches or the sleepless nights. So how do we cope with that? Do we turn to drugs or alcohol or other addictive or dangerous behaviors? That's a coping mechanism, and it's totally valid. It makes sense that you would want to escape those painful physical memories or the snippets that you do remember. Is it healthy? Is it helpful? Not so much. So do you have healthier coping mechanisms? And that could look a million different ways for a million different people. Some other resilience factors are, were you able to, or do you feel like you were able to respond effectively to the trauma? You know, and that kind of is a spectrum of helplessness versus power, empowerment. If the trauma that you experienced was completely overwhelming, that would probably point more toward or predispose you more toward unresolved trauma. If you were able to successfully fight off that tiger or outrun that tiger or exit the relationship, can you look back and say, it was really frightening and angering and dangerous, and I got myself out of it? That's a real big predictor of being further along in your healing process or being more resilient to those troubling symptoms.
Okay. Yeah, that makes sense. Yeah. how do we treat this? Everyone always wants to know, will it go away? How do I do it?
Yeah.
Can I do it tomorrow? They just want it over with and done, but
Right.
I don't think that heals quite that fast. And I know you've got some information on how we can treat this trauma,
Yeah.
enter into the PTSD and the treatment. So
Right.
what kind of things do we have to do to start healing these wounds?
Yeah. Yeah. Well, that is the kind of the $1 million question. And I really wish I could say, you know, take 2 pills and call me in the morning.
That's what my doctor says.
That's a whole other topic, but that's part of the problem.
Exactly.
Our society is sort of geared toward quick fixes.
Yeah.
The bad news is there's no quick fix. The good news is it is possible, and it is a journey. There are really many kinds of help that someone can seek. In general, healing from a trauma, moving beyond it, centers around relearning, rewiring the brain. That, remember I talked about the sympathetic nervous system. Well, now's a good time to talk about the opposite, the opposing symptom, which is called the parasympathetic nervous system. I'll talk about that in a second. But in general, it's learning to feel safe in the present moment, learning to feel safe in your body. Physically, do I feel safe? Do I feel like nothing's about to eat me? That I can handle what's happening in my physical surroundings and in my body? Do I feel safe feeling emotions? And we've talked a little bit today about it's very natural for trauma survivors to not want to feel.
Right.
It can be overwhelming, even the positive emotions. So learning how to, or relearning how to feel safe with your emotions. And finally, and really importantly, learning how to feel safe with others. Learning how to seek help, how to feel connected, how to feel safe. That's sort of the kind of the general goals, I think, of that treatment. As far as how do you do that, there's a lot of ways, and the research is increasing almost exponentially on lots of different modes of treatment. Everything from trauma-informed cognitive behavioral therapy to something called EMDR, eye movement desensitization and reprocessing, been shown to be incredibly effective at helping resolve some of those stuck trauma responses. There's something called somatic experiencing therapy, which is focused very much on that bodily memory of the traumatic situation, and it helps you to express and to discharge a lot of physical sensations that could be stuck. For instance, and I am not a somatic experiencing therapist, but for instance, if I have been assaulted and I was held down, well, my body had still mobilized all of my strength to fight back, but I was stuck. I couldn't. So in a somatic experiencing session, a therapist might ask the client to imagine that situation and physically make the movements that he or she wanted to as a way of completing that trauma response. That's been shown to be really effective. I personally offer equine-assisted psychotherapy. Might sound kind of strange, but working with horses is a very powerful way to access, to learn some self-regulation techniques, to learn presence and to feel accepted in the presence of another being, to practice feeling connected to ourselves, to our bodies, to our emotions, and to another being that is less scary and less less overwhelming than a human connection could be at the beginning.
Unless you got thrown off a horse, then that wouldn't work so much. Because that's one of my fears, because I got thrown off.
Yeah, that could be a trigger. And you're absolutely right. And that's a really good point, that the nice thing is there are so many roads to Rome. You don't have to choose just one. Now, 30 years ago, 50 years ago, the treatment of choice for trauma was exposure, or, talk about it, tell me about it over and over again. And the unfortunate thing is, for a lot of people, that just re-traumatizes them, because their bodies are already stuck in a trauma response, in a fight, flight, or freeze response. If we were to ask you, tell me all about it, while you're already in that response, all that's going to do is strengthen all those neural pathways, reinforce and re-traumatize that even thinking about that experience is threatening. So the more sort of modern approach is to acknowledge that we might not want to talk about it until we know that we can maintain a calm body, that we can keep ourselves from being physically reliving the experience. And that gets to what I was just saying a moment ago about the parasympathetic nervous system. So if the sympathetic nervous system you can think of as fight or flight, then the parasympathetic can be thought of as rest and digest, or even feed and breed. These are from the animal kingdom. So whereas the flight or fight response, let's say, makes your pupils really big, the rest and digest shrinks those. The fight and flight might increase your heart rate and make you breathe quickly and shallow, because it's designed to get your body ready with as much blood and oxygen as possible. The rest and digest system will slow your heart rate, will slow your breathing rate, will make you salivate again. The fight or flight stops salivation. You don't want to choke on saliva when you're running from a lion, but that creates the dry mouth that we often associate with trauma. So one of the important steps is accessing that parasympathetic nervous system and all of the calming changes it creates in our bodies before we expose ourselves to those traumatic memories. So most people think that the brain controls the body. The really good news is that the body can also control the brain. So if we consciously can initiate some of those parasympathetic nervous system changes, then that can actually send a signal up the system to the brain that says, hey, we're safe. We're breathing very deeply and slowly. That must mean that there's no lion chasing us. And then that begins a cascade of relaxation, or at least, maybe that's too much of an overstatement. It begins a cascade of recalibrating back to the baseline. So it breaks that fight or flight cycle. So one of the only ways, maybe even the only way that we have, not the only way, but the primary way we have to activate that parasympathetic nervous system. Remember, most of this is completely unconscious, and that's how we want it. That's gotten the human race where it is. We can't think about our heart beating every time. What we can think about is our breathing. So that's one of the only autonomic nervous system functions that is also voluntary. That's why you hear a lot about breathing exercises, deep breathing. That does a lot of wonderful things for the body. And one of the things it does is it activates that rest and digest, that counteract that trauma response, that fight or flight response. So a lot of the techniques that I work with and teach are breathing techniques, lots of different kinds of ways to focus on your breathing that are exactly the opposite of the shallow, quick breathing that we find ourselves in during a trauma and when we're triggered and remembering, reliving that trauma like in a flashback.
Mm-hmm.
So, as I said, there's lots of ways to seek help, to seek support, and they all show great promise. Hypnosis also, neurofeedback. These are all really promising ways, and one size doesn't fit all. I would encourage everyone to explore. Either explore on the internet or go make appointments with 3 or 4 therapists who do different things and see which one feels most authentic and helpful to you. So I kind of categorize, I call it, the way I approach trauma, I call it the 4 R's of trauma healing. And we've talked about all of these, but this is just how my brain works and how I organize. So the first R is to reframe. And we've talked about how it's really important, first and foremost, to change the mindset. I am not broken. I have experienced a horrible, catastrophic event or circumstance. That doesn't mean that I am irrevocably broken. And all of these symptoms that I'm having don't mean I'm going crazy. They're not all in my head, in my imagination, I should say. They are all in the brain, in the imagination. I'm not imagining this. I'm not crazy, despite what my friend or boss or mother-in-law says. So that's the first step, is just learning about the reality that we've talked about here today. The sympathetic nervous system, the body's brilliant adaptations to keep us alive during a traumatic experience. So then the next R would be to regulate, and that's what we were just talking about. Learning ways to keep my body calm, just as a baseline, and learning ways to come back from being triggered. So I kind of think of this step as kind of similar to managing asthma. I know that sounds really weird, but if you know any people who have asthma, or if you have asthma, you know that often there's a maintenance medication that you take every day to prevent an asthma attack. But then if an asthma attack happens, there's also rescue inhalers that can very quickly, open up those airways and stop that attack, or at least minimize it. I think that self-regulation works very similarly. There's countless ways to create that baseline, to create that maintenance of calm. Everything, I guess the classic thing is meditation, but that doesn't have to be the only way to do it. Sitting in a lotus position. People have a bad image of meditation sometimes, but yoga, exercise, massage, Tai Chi, Qigong, other Eastern martial arts, healthy sleep habits, healthy diet. These are all things that help kind of maintain a calmer, even things like art and music, journaling, actively looking for beauty. These are part of my maintenance suggestions. And then the flip side is, it's not going to solve everything. There's still going to be triggers in life. So what do you do when you're triggered? That's what everyone wants to know. How do I get out of this? Breathing techniques would be my number one suggestion. Things like body scanning, things like progressive muscle relaxation, things like grounding exercises. Remember I said that when we're triggered or when we're having unresolved trauma, the present moment doesn't always feel safe. And so we try to disassociate with it, or we just can't feel in the moment. That goes back to all of those neurological changes in how our brain works. We can combat those by using grounding exercises that bring us back into our body, bring us back into this moment. Something as simple as name 5 blue things in the room. All of a sudden, your brain is thinking, okay, I'm in the room and I'm looking for blue things. Or, name 3 things you can hear right now. using your senses to ground your body is a really effective and very easy technique. It's something you can do in the grocery store checkout aisle. You can do in traffic. You can even do in the midst of an argument. You know, I would not recommend meditating on the highway,
No.
but you can certainly ground your body and do some breathing exercises on the highway. So those are all part of the second R, which is regulation. One of the nice things is those two R's alone, the reframing and the regulating, can go a long way to minimizing some of those really distressing symptoms like nightmares and flashbacks, because you're living more in that parasympathetic, that rest and digest system that our bodies have. And you're living less in a hyper triggered, hyper alert fight or flight mode. It's certainly not a magic answer, and it might not eliminate everything, but it might make it so that you can get 3 hours of sleep instead of 45 minutes.
Right.
It's a step in the right direction. So the third R is retelling. And it kind of gets back to what I was saying earlier about how sometimes retelling your story can re-traumatize you because your body is reliving it. What I mean by retelling is find a safe person, whether that's a loved one, a spiritual advisor, a priest, a rabbi, a pastor, or a mental health professional, someone you feel safe with, and begin exploring what did happen. What was the experience? And while you're doing that, it's critical to keep the body regulated, to notice when you're getting triggered just by telling the story. Are my hands clenched? Am I sweating? Is my heart beating faster? Am I shaking? These are all common reactions to telling your story, and they're not wrong. And hopefully by that point in the process, you have some tools in your tool belt to say, okay, I'm really feeling myself getting triggered here. I'm going to use a grounding exercise, or I'm going to take 5 deep breaths. And the way that helps is when you get good enough at that, when you get used to that, if you're telling your story while your body is calm, that's making new pathways in your brain. That's saying, I can tell this in a safe way. And every time you lay down a new pathway and then reinforce it, it gets stronger and stronger and stronger. And hopefully, ultimately, it overpowers that traumatic pathway. And your brain and your body realize that I can tell this story and I am safe and I feel safe, so I'm not re-triggering myself. That's the third one. And the fourth and final step, the way I conceive it, the R would be reclaim. And this is where I think it gets really exciting or really empowering. It's the part in the process where you're able to acknowledge that something horrible happened to you. I would never suggest someone try to minimize or forget or deny that. And at this point, I'm able to create a coherent story. I'm able to put it in perspective. In other words, that is something that happened to me in my past. It is not happening today. I can, with that context, with that perspective, then I can use my energies to look forward, to find purpose again, to make my life meaningful again. People hear me talk about this and they just think I'm this most naive little Pollyanna, BS artist. And I get that. And I'm not saying it's easy. Again, I've said this before today. It's not easy, but it's possible and it's important and it's life-giving. So that's why I get really excited about, trauma. Boy, that sounds really, really bad.
Well, you said you were a geek, so that makes sense.
I get excited that people can and have and will continue to move beyond it or carry it with them in a manageable, meaningful, empowering way. How many stories have you heard about people who have experienced just horrific events or conditions for a long time and have somehow gotten to a point where they carry it with grace. They build a meaningful life. They make meaningful contributions. They are not angry and bitter and shut down. That's kind of my holy grail for myself as a trauma survivor and as a mental health professional. Am I there? Not always.
Mm-hmm.
Again, it's a journey, and it's a long one. And
Yes.
the good news is you don't have to walk it alone.
Right.
There are people, lots of people, who are ready to help in any number of ways.
Yeah, I look at, when you were just talking about the people who have had such traumatic things, my brain immediately went to Elizabeth Smart, who was kidnapped and raped every single day, and now she's changing the world. She's our inspiration. She's grace. You know, there's so many people who have had such horrible things happen to them that at some point there's a fork in the road where we stay stuck, or we make the decision and go, I don't know what's going to happen. I don't know what is going to work, but I'm going to try every goddamn thing that there is to show my body that I'm okay. And then if this is what it takes, I'm willing to do it. And that's the difference between the ones that are angry and the ones that make it and give us light. Because that's what we want here. We want to see that someone has been through worse than us and look at them, they did it, I can do it too, and hold on to that dream.
Yeah, I mean, what you're describing is the shift from post-traumatic distress to post-traumatic success.
Ooh.
Now, I, in all honesty, I can't take credit for that very cool phrase, but I've stolen it because it's so good.
Oh yeah.
I think it is also important to recognize that after a trauma or a loss, we don't want to feel better right away. I mean, there's a reason that we don't want to immediately look through rose-colored glasses and say, I'm going to be successful. The fact that someone might be stuck, again, big air quotes, in that more victim-y or less powerful perspective, again, does not mean they're broken. That's where they are in their journey, and that's perfectly fine. That's where we all have to start. And we all have a choice about how long we stay there. We all have access to knowledge and support that can help us once we've made that choice. Are we all rich? Can we all afford 3 therapy sessions a week? No. But we can all read a book, or we can all go see a priest, or we can all talk to a friend. So it comes down to be stuck. That's fine. That's part of your body rebooting.
Yeah.
You know, when you turn off a computer, you don't turn it on and immediately start writing a letter. It's got to warm up. That's a good way to think of it. So reboot.
Yeah.
Absolutely.
Yeah.
And then what?
Right. So let's round this up with, what are some realistic healing expectations? Because I know that we don't want to lead them down this path and go pet a horse and you're going to be okay tomorrow.
Right.
What's realistic with this?
Yeah. Well, I think we've been talking about it for the last few minutes. It would be unrealistic to assume that I can turn back time. I can magically, with either some therapy or a pill or anything, make it so this didn't happen. Make it so that I completely forget it. It's not. That's just not how the brain and the body work. So that would be an unrealistic expectation. It would also probably be unrealistic to think I can go back to exactly who I was before this happened. it's undeniable you have been changed. This experience, through no fault of your own, has changed you. So wanting to recapture exactly who you are or who you were might lead to disappointment and frustration. That doesn't mean you can't be who you want to be, who you're going to be. Again, that's that sort of shift in disempowered versus empowered. So I think that's a realistic expectation, is to learn, however quickly or slowly this journey is going to go, but to learn how to carry the experiences you've had in a way that's less of an anchor and more of just something you carry. Ultimately, and again, this is going to sound really naive and Pollyanna and Hallmark cardy. Ultimately, if you think of it like a brick, you start your journey with that brick tied around your neck. Mm-hmm. Then with enough work and time and effort, you can get to a place where you hold it with two hands. It's no longer strangling you, but you're still holding it. Then maybe, hopefully, with more work, more time, you can learn how to hold it with one hand. And then all of a sudden, you've got all this extra energy over here to reach out for whatever you're trying to reach for. Maybe ideally, you can even learn to put the brick in your pocket. That's just a way that I think a lot in visual metaphor. So that helps me. I don't know if that helps anyone else, but
I think I will always think of that now.
And again, I know that it's really easy for me to say this stuff in the comfort of my office. And, I'm not for a second minimizing the devastation that trauma can create, or the emotional, physical, psychic, spiritual energy it takes to walk this journey. Right. I would hate to leave anyone thinking, oh, I think it's easy. I don't.
No. Anything is always takes. If you're gonna get better, if you're gonna do anything, it takes work and recovery. As sad as people are that now I've got to do work. My abuser did this or that. Now I've got to do all the work. Yes, you do, because you were traumatized. So if you want to get out of it, do the work. Look at the things, whatever it is. Don't give up on it. Don't just wash your hands and go, I don't want to do the work. And then be stuck, because you can make yourself out of this hole. You can find the light, and you can change your life. And I know that you gave out to my support group this handy dandy flyer. And we were going to offer it to anybody that wanted to. Are we having them email you? How can they email you?
Yeah, I think that would be best to email me. The little packet that you just held up kind of has some pages on there that talk about the autonomic nervous system, so that you can sort of visualize what's happening in your body. It talks about some of the distressing behaviors of PTSD that we've talked about. It talks about the 4 R's, because that's sort of how I visualize treatment. And then it lists some self-regulation tools, both the maintenance and the rescue tools. And yeah, I'd be really happy to email anyone. It's not intended, these sheets are not intended to be complete instructions on any of this. It's really just sort of a cheat sheet, a thought starter, if you will. And I'm happy to talk with anyone and share these sheets with anyone.
Okay, well, we will put your email below. And as you can all see, his website is listed across the bottom, pathforwardcounseling.com. And I want to thank you so much, Dave, for coming here and giving us all this information. It was amazing.
No, thank you. It's really, it's nice to share. As you can tell, I'm pretty passionate about this stuff, and I want to communicate a message of hope to as many people as possible.
Well, this is
thank you.
Thank you so much. Isn't that awesome? He is just a wealth of information. And as he said, he's a geek. A geek on PTSD is my kind of guy. So I want you guys to pick up your pen right now and write down Dave, D-A-V-E, at a path forward counseling.com. We'll put the link up above, down below, I guess it is. We'll put the link in the comments for you to find and send and ask him for this amazing little handout. It's a bunch of pages, but it's going to include the soothing tools, the explanation of everything, and he's laid it out so well that I think it'll help you understand PTSD and give yourself a little wiggle room, a little understanding and self-compassion that you're okay where you are and there is a light at the end of the tunnel. So that's all I've got for you. Visit my website, narcissistabusesupport.com, and subscribe to my channel if you haven't yet. We feature all kinds of different videos to help you heal. So thank you so much for watching, and you made it through. You did the work by listening to this video. So thank you.